While much of the world has moved on from worrying about COVID-19, the fact is it's still out there, mutating, and people are still getting sick. The U.S. CDC says there's a summer uptick underway in COVID cases, and right now, more than 12,600 Americans are hospitalized with it. That's up 22% over recent weeks. U.S. President Joe Biden has just signed off on a proposal to Congress to get more money for vaccine development, and pharmaceutical companies and the FDA are gearing up to release an updated vaccine as soon as next month that would provide protection against some of the latest variants. Dr. Pernell is Regent at Large for the American College of Preventive Medicine. She's also a public health physician, and she joins me now. Doctor, so wonderful to have you with us. We're seeing a notable uptick in COVID cases. What are transmission rates like, and why are we seeing this uptick?
Thanks, Laila. I think it's important for people to understand first and foremost that the COVID-19 pandemic, because it's still a pandemic and it's actually endemic in certain places, and it's still not in an emergency phase, but it's still something that we should be ever present and vigilant about. What we're seeing in this summer, as the summer closes, we're seeing a slight uptick. Approximately 12,600 Americans were hospitalized due to COVID, which is about a 22% increase. Why is that happening? There is constantly the evolution of different types of strains and variants. And those strains and variants seek to gain an advantage, whether it's a person who may not have been vaccinated, a person who may not have received the updated bivalent booster, a person who has other chronic health conditions, or a person who's older. So that's what we're seeing happening as the summer comes to a close.
So if I understand you correctly, do we know if it's making people sicker? And how do we protect people who are most at risk and who is at most risk?
So commonly available data right now is not showing that it is a more severe strain. We're seeing what we saw with the other Omicron subvariants, meaning that it's a predominantly upper respiratory illness. What does that look like? It can look like a cough, runny nose, sore throat. But if you are a person who is older, especially 65 and older, or you have chronic health conditions, that might evolve from an upper respiratory illness to a lower respiratory tract illness, which could develop into a more severe pneumonia or something of that about. So how do you protect yourself? Get vaccinated. And it is important to get vaccinated with the most currently available bivalent booster. And that's going to be available most likely in the several weeks to come in September.